My name is Sara Curran, and I'm an associate professor here at the University of Washington. I direct the Center for Global Studies, and I chair the International Studies program for the College of Arts and Sciences. I'm also trained as a social demographer and have an adjunct appointment in the Department of Global Health. And this panel has particularly significant meaning for me because of the 250 undergraduates and 50 graduate students that I see come through my door on a regular basis. I would say a third of them are passionately interested in health and global health and concerned greatly about how they can work transnationally and locally on addressing global health concerns. And although we don't yet have a program here at the University of Washington, there is significant interest in the possibilities of possibly creating building capacity in something now called health diplomacy, global health diplomacy. And so this panel brings together some of the leading thinkers in this field and challenges all of us to think about what is global health diplomacy and what are its possibilities. I want to say thank you first to the CUGH organizing committee, program committee, especially Judy Wasserheit, who shepherded this particular panel through the program administration and was extremely encouraging and tapped into her enviable networks of contacts and resources. In addition, I want to thank Dr. Gostin, who's also on the panel, who helped organize and connect and network and make this panel possible. I'm going to give just a little bit of an overview. What I'd like to give you the heads up about, first of all, is that the panel is not as it is and will not be organized in the listing in your program. Instead, we'll be starting with Dr. Kelly Lee from the London School of Hygiene and Tropical Medicine, followed by Dr. Peter Lamptey from Family Health International, Dr. Kate Bond from the U.S. Food and Drug Administration, who is taking the place of Peggy Hamburg, and Dr. Lawrence Gostin, who will wrap up our session. The ordering of the panelists follows a conceptual notion from big concept to particular applications and case studies for us to learn from. Well, why do we need health diplomacy? We have increasingly, obvious for all of us, why we're all here, disease globalization, the recognition of the global impact of local health burdens, persistent international conflict around the world that both low-grade and high-grade that increases vulnerabilities, threats to human security through multiple global challenges, including trade, climate change, and technology, the emergence of late 20th century global health institutions and funding initiatives that challenge national sovereignties, and the need to address ethical and equity concerns resulting from globalization, for example, associated with biomedical technology, health science research, and global responses to disease outbreaks. Now, the idea of global health diplomacy is a bit outside the purview of what we think of as diplomacy from an international relations perspective, because generally diplomats are those emissaries emanating from a particular national sovereignty and representing the interests of a particular national sovereignty. Global health diplomacy breaks down that wall and proposes a set of emissaries who may be representing national sovereignties, but may also be representing interests, stakeholders who have an interest in global health as a public good, and whose institutions may be transnational in nature rather than nationally grounded. Their goal is to raise the profile of health in international relations and international policy making, to solve international and global disputes, improve global and local health systems, ensure timely and sufficient cooperation for disease outbreaks, secure the right to health for vulnerable populations, and build bridges and deepen relationships to complement international or global relations and institutions in other arenas, say global environment or peace and security. So health diplomacy, global health diplomacy has two purposes. One is improving global health, and the other is maintaining and strengthening international relations and institutions of global cooperation and peace. In that sense, one needs to have teams of diplomats who have a sense, global health diplomats, who have a sense of both international institutions and cooperation and substantive depth and knowledge about health and epidemiological disease relationships. Many health diplomats advocate that health diplomacy is a social responsibility, that it's practiced with cultural and political sensitivity, and it can be a political negotiation tool. In some cases, health diplomacy has been co-opted by particular national sovereignties as a form of soft power. In other cases, it's taken up by, as I said, transnational non-governmental organizations or even faith-based organizations in the interests of, along hand in hand with their other interests that they may be attempting to address. So it can be, can be at times, initiatives can be at odds with each other. In addition, global health diplomacy, though, as I've mentioned several times now, recognizes that one can begin to advance multilateral dialogues via civil society or the private sector, rather than just through national sovereign institutions and governments. So who are global health diplomats? These can be foreign service officers, ministerial emissaries, non-governmental development agents, corporate or private sector health leaders, clinical health workers, and they practice both their health work with significant competencies in navigating international, national, political, cultural, and economic contexts around the world, and they practice their political work with significant health expertise to interpret and evaluate the implications of health research and policy. So what we have today are four panelists who are going to give us both an overview. Dr. Kelly Lee will give us a sense of what is health diplomacy and how do we understand it. This will be followed by Dr. Peter Lampe, who will be talking about health diplomacy from the perspective of a national sovereign interest. You know, why is it in America's national interest to be engaged on global health issues? Dr. Kate Bond will take us back to the global level to think about how we should be thinking about global regulation and regulatory capacity for global health. And then finally, Dr. Larry Gostin will talk about some particular cases, a particular case of the Joint Learning Initiative on National and Global Responsibilities for Health, which was an institution-building health diplomacy initiative. So without further ado, I'd like to invite Dr. Kelly Lee to the podium. Our panelists are sitting here during the talks, and then they'll join us up at on the stage later for question and answer. Thank you for coming.